Autonomous University of TLAXCALA, Faculty of Health Science, degree in nursing. My name is María Fernanda Aguilar Chu.
My name is Kevin Lopez Romero, teacher Leticia Enriquez Rojano, and group C.
Introduction. Coronaviruses are zoonotic viruses, that is, they can be transmitted between animals and humans. The infection can be passed from person to person, usually after close contact with an infected person. It mainly infects cells of the respiratory tract and the gastrointestinal tract. Clinical manifestations. The most common clinical things include highlighting high fever, thoughts of a common cold, short throat, dry cough, and fatigue. It is recommended that people with mild symptoms and good general health be confined to the home. Diagnosis. The samples are analyzed to detect the presence of coronaviruses in diagnostic laboratories through laboratory tests carried out at INRO. The healthcare provider uses a long swab to take a nasal sample, sputum. The sample is sent to a laboratory for analysis.
Risk factors. The risk factors associated with COVID-19 disease are travel or recent residence in an area where transmission continues, close contact, less than 6 feet or 2 meters with someone who has COVID-19, diabetes, hypertension, immunosuppressive people due to a disease like HIV, older adults with a chronic illness. Treatment. Today there are no specific vaccines or medicines against COVID-19. However, professionals have opted for conventional treatment. Drug treatment is material as remdesivir and lopivir. How to take for intravenous use. How much to take in adults and children over 12 years is recommended 200 milligrams for 1 day. For will be maintains doses of 100 milligrams every 24 hours for 9 days. Don't exceed the indicated dose in 11 days. Lopivir or ritonavir. How to take for oral use. How much to take in adults and children over 12 years is doses 400 milligrams and 100 milligrams, respectively, twice a day for 14 days. Don't exceed the indicated dose. Non-pharmacological treatment, oxygen therapy, and ventilatory support. In patients with airborne respiratory distress, hypoxemia, or hemodynamic instability in critical areas, they should receive oxygen therapy during resuscitation to maintain oxygen saturation greater than 94%. It is recommended to start with nasal tips at 5 liters per minute and adjust to maintain optimal saturation.
Clinical case. Patient with coronavirus. The patient enters the emergency room located in Department 8 on the first floor. Domingo Blasky is 68 years old, born on June 24 and 1952. He has an oxygen saturation of 80%, measured with an oximeter and blood pressure of 140 and 80, with a respiratory rate of 20 beats per minute and a pain scale of 18 in the pulmonary region, with finding pneumonia and positive for COVID-19 and nasogastric exudate. The patient was insulated and maintained with mechanical ventilation. He entered the internal medicine area with respiratory failure. The respiratory failure has worsened in less than 24 hours, and he has severe diarrhea, for which he is sent to intensive medicine and sponge bath because he is completely dependent on the nurses. It presents a good response to pharmacology treatment and ventilatory support, improving its oxygen saturation and fever. After 20 days of hospitalization, she decided to register to improve with the following discharge plan. Post-discharge care. After discharge, you can live at home, no need to insulate yourself. I recommended that you take hygienic measures such as washing your hands, wearing masks, disinfecting areas or objects of daily use, avoiding going to places with many people.
Personal care. Mr. Domingo is independent to go brush his teeth, so it is explained to him that it must be 3 times a day. It is also independent for bathing, so only the use of anti-fall mat or the use of a bath chair is recommended. He needs help cutting his nails, so we ask a relative who lives with him for help. Taking medication. It is important to know your prescription medication, when to take them, and what side effects you may experience. I am recommended that you ask for the name and number of the person to call if you have any question, and can still take them after discharge. Remember that there are medications for oral, intravenous, and intramuscular use. I recommend that you check in the bottle box and bottle how you should administer it. Nutrition. It is important that you ask your doctor about the foods you can eat after discharge. He can give you a diet according to your age. Do not forget that it is recommended to avoid sugars and soft drinks. According to the food pyramid, you should consume foods of level 1, 2, and 3, which are foods rich in carbohydrates and proteins, as well as fruit and vegetables. You should also consume at least 1 or 3 liters of water.